Hi class, my name is Cynthia and I'll be talking to you about the nurse I interviewed. So unfortunately, I work at Kindred Hospital in Brea, and according to the clinical educator department, the hospital does not have a clinical informatics nurse. So instead, through a classmate, I ended up interviewing a coworker that she knew. So I interviewed April Clayhane that works at Anime Health. And in this video, I'll be talking to you about April Clayhane, about her experiences, why she went into clinical informatics, any certifications that she had in order to work as an informatics nurse, her career transition. Then I'll be going into the value of informatics, any safeguards that informatics has in order to help the hospital become, like within infection control or anything, and patient care technologies that have improved the hospital, um, relationships that she has with the ITS department and any other coworker that relies on her, or other departments that rely on the clinical informatics nurse. And I'll tell you about a question that I asked her from my personal experience in the healthcare field. And then I'll be sharing with you about how the interview I had with April would impact how I practice as a master's prayer nurse. So, for April, she is a clinical informatics nurse, and for her, she actually started nursing in the 1980s. She doesn't have an actual, she actually she has a bachelor's degree, and she's a registered nurse. But for her, she went into clinical informatics after having been a NICU nurse. So she was a NICU nurse in the ICU, a charge nurse, um, in the ICU, and I guess she told me that she was tired of dealing with the politics and personalities because she had to supervise about 150 people. And in the ICU, a lot of the personalities were hard to get along with. She mentioned that people had type A behavior, and then suddenly she was approached by a clinical informatics nurse. The idea of it was that it was a new field, so she was contemplating about it because she was tired of bedside nursing, and then she decided to join. So it was fortunate for her because back then she was grandfathered in, so she didn't have to have any of the amount of degree or anything. And she's at MMA Health, which is also CVHP. So at CVHP, they have a team of 6 people on their informatics team. 4 people are RNs, and they actually have BSN degrees. However, there are 2 workers that are in informatics who have no degree at all, and they're not nurses. So 2 people aren't even like RNs at all, and they're still in informatics. And nowadays, she said the good thing is her organization does not require a RN, or it requires an RN license, but there's not a degree that the licensed nurse needs to have in order to become a member of the informatics, to work in informatics. However, the only exception is that in Kaiser Permanente, they require their informatics team to have at least a master's degree. So, depending on the facility or hospital, not all places require a higher degree or any form of degree for informatics nursing. But the one thing that April mentioned was experience. In informatics, the informatics team definitely needs to have experience, especially for her. Teaching care today requires a lot of use of technology. So care at the bedside, there's less care at the bedside because a lot of the times monitors and equipments are used right now, and we look at screens like EKG screens and like those monitors just to troubleshoot the person. So it's really important to know a lot about technology these days, and to help to become a floor nurse too. And it's also important because um, technology nowadays is used to help like infection control with like MRSA screening, sepsis screening. We look at the values from labs on the computer. We have to find those values through the computer, somehow utilize the EMR system, which if we don't have, as a nurse, if you don't have the capability and skills to do that, then that would not be a good thing. As healthcare these days is overridden with technology, um, the hospital even implemented a lot of safeguards, such as like ID bands, patient care ID bands, computers, labels, and interventions for patient-specific medications or anything that they need, anything the patient needs. So what happens is that there's a scanning system when the patient needs medication. Their ID band is scanned to make sure that it's the correct person, the correct time, and the dose is all so that the medication will be given to the correct person. Otherwise, there's a lot of room for errors. How would they know if the medication is supposed to be given to that specific patient, or if the patient's even receiving like their their, their appropriate medication? So those are some issues or problems that require an informatics RN to actually intervene with, because they know how to use, how to troubleshoot, what data exists at what location, and if anything needs to be revised, ITS will help with the JavaScript and formatting the interface, while while the informatics nurse, the IN nurse, will tell them where to put everything on the screen. So April actually works with the ITS department. Like previously, I stated that there were 6 people on her team, 2 of which is the ITS men. So the ITS men work to do the interface, and other people that rely on her is the case manager and the social workers. So the case manager and social workers typically ask for help when they find errors in patient information or troubleshooting mechanical equipment that has dysfunctioned. So there's a ticketing service, and case manager social workers submit a ticket request to the informatics team, and then the informatics team will check the request on a daily basis to make sure that things are being done and patient errors are getting reviewed, and equipment also become troubleshooted for necessary calibration or updates. So a big concern that I always had was working with the EMR system. So my personal question that I asked her was, does going into an informatics higher education program help with learning the EMR system or help with troubleshooting equipment faster? And unfortunately, what April said was, no, it does not help. So this was funny because my weak skill set ever since the past has always been navigating the EMR and finding where appropriate documents may be located. And I'm pretty sure a lot of even the older adults, older generation nurses have the same problems too. And I would think going into higher education, it might expose them to projects that might help them in the future employment in the hospitals where they're going to be employed. But unfortunately, all hospitals have different systems, and one higher education level program does not necessarily help with learning, and documentation is also highly important. So I guess as a master's per nurse, I will be ready to learn the entire system really fast, as fast as I can. And because a lot of the times you have other tasks on the side to do aside from your patient care at the bedside and documentation skills, you have to also navigate fast. So I would be able to help use my experience to help the new employed RNs document and navigate the system in order to save their time, because their time can be set back to the point where they might completely fail to chart an entire patient assessment. The idea behind nursing is always, if it was not documented, then it was not done. So I would always be there to help lend a helping hand if anyone needs it.